Om Swastiastu. Hello everyone, we are from Small Group Discussion B8, Udayana University School of Medicine. In this given opportunity, we would like to present our student project about repair by scaring. These are our group members. And this is the outline of our presentation for today, which contains three major parts that are introduction, content, and summary. So without any further ado, let's start the presentation.
My name is Namita Nas, and now I will explain about the background of our student project, Repair by Scaring. When skin is injured, it has an intricate response system poised to repair the damage. Tissue repair following injury is a complicated event involving coordinated systems. For wound healing following surgery, trauma, chronic disease, or acute illness conditions affects millions of individuals worldwide each year. The hunt for critical techniques to boost the body's natural healing systems will require a full grasp of repair basic biology. Through this description, the mechanism of tissue repair, especially by scarring, is important to be studied. It can provide some insight on how to utilize and develop existing knowledge into appropriate clinical approaches and management for patient treatment in the future.
My name is Tiffany Cecilia, and now I will explain about the problem formulation, objectives, and benefits. First is problem formulations. So the problem formulations are: what is scarring, how does scar form, what factors that influence tissue repair, what are the abnormalities in tissue repair, and what are the types of scar. Next is objectives. So the objectives are to describe the definition of scarring, to describe the step in scar formation, to describe the factors that influence tissue repair, to describe the abnormalities in tissue repair, and to describe the types of scar. Next is benefits. This paper aims to understand repairing by scarring, which includes the definition of scarring, step in scar formation, factors that influence tissue repair. Moreover, we also cover the abnormalities and types of scar. Next.
Thank you for the opportunity. My name is Natania Catherine Suteja and I will explain about the definition of scarring. Scarring is one of the repair functions in the human body that happens when the extracellular matrix in a wound is damaged and incapable of supporting regeneration. The damaged tissue that has lost its capability to regenerate is repaired by the connective tissue that forms upon it. Scarring repairs the tissue by depositioning the fibrous tissues on the injury site. This process can also be called a replacement. The appearance of scarring depends on the location in which a wound occurs. In labile tissues such as skin and gastrointestinal epithelial cells, the cells are constantly dividing with high self-renewing ability, resulting in minimum scarring. However, if an injury happens to a permanent tissues like skeletal and cardiac tissues or deep into underlying tissue structure, the repair process afterward will always leave a permanent evidence, which is a scar. The next part will be continued by my friend.
My name is SGD Nathan, and now I will explain about steps of scar formation. Wound healing occurs in orderly sequence of overlapping stages that cause reformation of the tissue and left scars as the end product. The process of scar formation involves four steps. First one is hemostasis. Next is inflammation. Third one is proliferation, and last is remodeling or maturation. Now I will explain about the hemostasis. Hemostasis is the first mechanism that occurs during bleeding, and the main objective is to stop the bleeding. This process began immediately after the injury occurred. Next is inflammation. After the hemostasis is complete, cells are sent to heal the wound. Cytokine is released and cause the movement of neutrophils followed by macrophages. The first neutrophils dominates and is attracted to the wound bed, removing bacteria and necrotic tissues in the first 48 hours to 72 hours. After that, monocytes become macrophages and perform phagocytosis of pathogen and cell debris. And macrophages are also responsible for cytokine synthesis and the release of growth factors. The last two will be explained by my friends. Thank you.
Thank you so much for the time. My name is Duputo Adin Praena and I will continue the explanation. So the third step is proliferation. So proliferation is basically when the wound is now clean after inflammation phase and reepithelialization occurs to close the wound. This phase also involves angiogenesis and collagen deposition. And the last step in scar formation is remodeling or maturation. So the final process of scar formation, the wound is healed and left behind scar. The connective tissue that has been formed by fibroblasts is reorganized to produce a stable fibrous scar.
Thank you for the opportunity. My name is Kadep Pramdia Agastekana, and now I will continue explaining about the local factors influencing tissue repair. The first one is wound type. There are a few types of wounds. Each wound could give a different level of recovery. For example, a surgical wound usually leads to a better recovery than a bruised wound. The second one is infection. When the skin is damaged, microorganisms that are normally isolated on the surface of the skin will gain access to the underlying tissue. Therefore, accurate wound resection of necrotic tissue and exudate is crucial to ensure better wound healing. The third one is iatrogenic factors. In this case, iatrogenic factors affecting tissue repair include improper use of dressings and suturing techniques. If doctors apply the wrong techniques, it could lead to a pathological or absent scar. The last one is oxygenation. Oxygen is essential for cellular metabolism, especially for energy production with ATP, and is critical to nearly all wound healing process. Several systemic conditions, including advancing age and diabetes, can create impaired vascular flow, thus setting the stage for pure tissue oxygenation. In the context of healing, this overlay of poor perfusion creates a hypoxic wound. That's all from me, thank you, and my friends will continue the presentation.
My name is Nathaniel Faustin, and I will explain about systemic fractures affecting tissue repair. Systemic fractures refer to the patient's medical conditions which affect their ability to heal. The first factor is age. The speed of repair is inversely proportional to age. In the elderly, delay of tissue repair is associated with changes in the inflammatory response. Despite its time delay, aging would not compromise the quality of healing. Next, medications. Some medications, such as glucocorticosteroids, nonsteroidal anti-inflammatory drugs, and chemotherapeutic drugs, affect tissue repairing process by interfering with clot formations, platelet functions, inflammatory response, and cell proliferation. The third is diseases. Diabetes is one of the most common diseases that could influence tissue repairing. There are also genetic conditions that can impair, slow, or even prevent the process of tissue repairing, such as Ehlers-Danlos syndrome, epidermolysis bullosa, Marfan syndrome, osteogenesis imperfecta, and Werner syndrome. Patient's nutritional state also affects tissue repairing. Studies show that malnutrition adversely affects the healing process. It prolongs the inflammatory phase by reducing collagen production and fibroblast proliferations. The last factor would be smoking. Smoking could reduce the chance of healing by increasing infection rates and reducing neutrophil activity. It can also cause a variety of complications, including infection, wound rupture, anastomotic leakage, wound and flap necrosis, epidermolysis bullosa, and decreased tensile strength of the wound. The next part will be explained by my friend.
My name is Sabrina Maria and I will continue the explanation. The title is The Abnormality in Tissue Repair. What is abnormality? Abnormality is a behavior that happens unusually. The abnormality can be caused by a disruption in nevascularization or angiogenesis. Like there is a component deficiency such as development and stabilization on newly formed blood vessels and regulating capillary flow-through and providing blood barriers and an adhesive substrate. As the result, the wound area doesn't get enough oxygen for healing and turn into a necrosis and ulcers.
Thank you for the opportunity. My name is Kian Aniro, and I will continue the explanation about abnormalities. Another abnormality can be caused by microbacteria presence in diabetes mellitus or people with hyperglycemia. This factor increasing bacteria's food or nutrients for life while leukocytes as the common defense development can do their work well. Hyperglycemia makes some results, make an abnormal metabolic related with the key receptor of cellular activities, PKC, and increasing pathologic byproduct like H's,
that can increase oxidative stress, activate key transcription factor, lead to collagen cross-linking, and inhibit normal collagen degradation. The result? Bacteria turn into a colonize, the abnormal metabolic complicate, the one that make infectious through the area and get faster.
Thank you for the opportunity. My name is Rosa Velani and I will now explain about the types of scars. Scars from skin tissue repair range from a normal fine line to a variety of abnormal scars such as widespread scar, atrophic, contractures, hypertrophic, and keloid scars. The first one is widespread scar. Widespread or scratch scars usually appear a few weeks after surgery in the form of fine lines. They are usually flat, pale, soft, and asymptomatic scars. Next is the atrophic scar. Atrophic scars tend to develop after an inflammatory process, which makes the skin lose its collagen, such as acne, varicella, and chickenpox. The scars will look flat and cause an indentation in the skin because the skin is unable to regenerate its own tissue. Next is the scar contractor. A scar contractor is the result of a contractile wound recovery manner taking place in the scar that has already been completely healed. Scar contractors are the type of scars that can lead to tightness in the skin, hence making the patient movement become restricted. That's all from me, and now the presentation will be continued by my friend.
My name is Doi Putwai Sakara Jasirikanini and I will continue the explanation about type of scars. The next one is hypertrophic scars, which are characterized by excessive tissue production as the area of a physical injury to the skin that remains within the boundaries of the initial lesion. This type of scars typically occur after burn injury, insect bites, or develop secondary to trauma that often looks red, itchy, or even painful as a result of a capillary overgrowth due to chronic inflammation. And the last one is keloid scars, which is a result of excess collagen produced at the site of the wound, which makes the skin surrounding the wound raised and look redder or darker than the actual skin. Any kind of skin injury can lead to keloid, and unlike hypertrophic scars that can heal themselves over time, keloid can't heal without external treatment.
My name is Zefania Rindi and I will deliver the conclusion of our student project. So scarring is a repair function in which connective tissue is attached to repair damage when the injured tissue does not heal completely, or if the supporting structure of the tissue is severely damaged. Scars are formed through several main processes, including hemostasis, inflammation, fibroblast proliferation, and connective tissue remodeling. Other than that, various factors can interfere with tissue repair, reducing the quality or adequacy of the reparative process, such as extrinsic or intrinsic factors that inhibit healing, and it can be systemic or local. Then, in the process of tissue repair, abnormalities in one of the basic components of the process can occur, such as insufficient scar tissue formation, excessive formation of repair components, and contracture formation. Furthermore, there are several types of scars from repair of skin tissue, ranging from normal fine lines to various abnormal scars.
Hello, I'm Raymond Albert Budianto, will give some advice according to the topic. We already know that repair by scarring is a very complex yet useful body mechanism. Thus, the abnormalities or malfunction of this mechanism can cause various problems. As previously mentioned, some of the factors which affect this mechanism are cigarette, diabetes, and nutrition supply. Therefore, we must first avoid smoking at all costs. Smoking reduces the healing potential by the direct vasoconstrictor nicotine effect, increasing the infection rate and decreasing neutrophils activity. Second, limit sugar intake. Atherosclerosis may occur in diabetic patients, which lead to slower blood flow and healing process. And the last one, pay attention to your nutrition supply. Malnutrition can negatively affect the wound healing process.
Lastly, these are references that we use in the process of making our student project about repair by scarring. Now we are at the end of our presentation. Thank you for your attention, and we would like to apologize if there are some mistakes that we made intentionally or unintentionally. We will close this presentation with Paramasanti. Om Santi 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 Om.